to have you all here with us.
Yep.
We are very proud to have you as our team members. It seems that you are working so effectively that we can even follow what is happening here in this conference place. Can we have a small round, if just to say who we are and what are our feelings at the moment?
Hi, my name is Mario and I'm the member of organizing committee.
I have been every conference.
My name is Johanna.
And I have been, this is my 7th time.
I am really looking forward to take the pictures.
Hi, my name is Kat. I'm a PhD student at Queen's.
My name is Virve. I'm organizing this conference now for I don't know how many years.
And my name is Oti, and this is my first time as a slave.
My name is Vladka. You can call me Vladka or Vladi, it's up to you.
Then I had this huge meltdown, breakdown. I needed 2 years off, and now I'm back.
I'm Reijo and I'm a newbie, first time here. I'm very glad that I can involve in this great happening. I'm a little bit nervous, to be honest.
My name is Aaro, and this is, I think, my 6th time.
And hello, my name is Kaisa.
Hi everyone, my name is Laura. I'm a PhD psychology researcher at Queen's.
My name is Susanna.
Welcome all to be here.
And maybe we can, perhaps like me here, I am taking these all together and put them here. So, and then already here.
Yeah, we'll put them on. Laita se kyynään.
We really wanted to have Mr. Peter McBride to be our keynote speaker. He has been working many years in the area of mental health and well-being promotion and has done a huge job in creating a new Belfast and new Northern Ireland.
Welcome to Belfast. This is a brilliant place. If you haven't experienced it already, you will over the coming days. This is a wonderful place to live. As I looked at that map of where all of you have come from, I see lots of places on that where there is or has been conflict. So those of you like me who have worked in mental health, I worked for 20 years in Inspire, which is one of the partner organizations. Our focus was on community-based mental health services. When we were providing care and support to people living with mental illness, we were doing it in the context of violence in our society. If you walk up in North Belfast today, you will see this. And indeed, many of you may, while you're here, do what's known euphemistically as the Troubles Tours. which I actually would recommend that you do, where you maybe go and see the peace walls or various murals around Northern Ireland, around Belfast particularly. This is the kind of thing that you will see.
Was it around that time that you began to move into kind of activism in mental health?
Yeah, so it's interesting. So anybody ever, show of hands, went through a transition in their career? Anybody? Right? Half of the room. Okay. So you know what I'm talking about. It gets tough when you're trying to figure out what's next for you. And so right before I left...
Good morning. Welcome to our presentation about function-oriented diagnostics. My name is Tobias Kalverdijk. I'm a mental health care nurse practitioner since 2015.
The rules. No running, no heading, means not playing with your head. No hard contacts. And let's keep the ball below head height. And after that, let's have fun.
Do it. Nice. Like it. Yeah.
Nothing.
Hi, I'm Emily Bovet. You pronounce it very well. I'm from Switzerland. Sorry if I'm not totally fluent in English, but I will try to do my best in the psychiatric field. As a teacher, I'm working with future caregivers, and as a researcher, I'm mainly working with nurses in psychiatry. This is a long-term project. Actually, it implies 3 university.
So this one, the red one, goes.
Oh, in this one here, yeah.
I don't know.
You're supervising?
Okay, now you're
Good job.